My name is Professor Dina Chelagat. I'm the Dean of the School of Nursing and Midwifery at Moi University. And as a university, we have 13 schools, and one of them is School of Nursing and Midwifery. We started training nurses in 1978, and in 2006, through the assistance or scholarship given to us by NEPAD, we started a master's program. This master's program prepared those who had been trained as nurses to be midwives. And among them are the lecturers that I have at the School of Nursing and Midwifery. So through our coordinator, Dr. Priska Mosol, we were able to get in contact with Dr. Rose, the director NEPAD, and was able to engage with the county, and we came up with a training of a planning for training of community health promoters. This we saw as the real contact people on the ground who could be able to identify the pregnant mothers and be able to ask them, encourage them to come for antenatal care and also give birth in the hospitals.
My name is Dr. Priska Mosol. I'm a senior lecturer at Moi University, School of Nursing and Midwifery, and I am also I'm among the first cohort of the NEPAD-sponsored students under the midwifery program in Moi University. And after my graduation from the program actually inspired me, first of all, to continue with my education, and I went further to undertake my PhD in medical education, and this has really helped me to be able to participate in the activities and to coordinate the activities in partnership with NEPAD Kenya APRM Secretariat.
So sometime NEPAD came round to check what is happening to those who are trained through the scholarship. As a monitoring and evaluation activity, they found that they were doing well, training midwives and nurses, and therefore NEPAD was able to look for some funding that supported us to train nurses and midwives. And so we've continued engagements with NEPAD, and we saw there was a need in Baringo County with the interaction with the health department. We saw there was need in addressing the maternal and neonatal morbidity and mortality.
My name is Dr. Joseph Kangor, the Director of Medical Services of Baringo County. We are basically here on training our CHPs from 2 sub-counties, that is Baringo South and Tiaty East. And we're actually trying to package for them so that they can play their role as a level 1, that is community unit. In this training, we are basically focusing on one, maternal mortality, which is actually a serious concern to us as a department and Kenya as a country. Issues to do with delivery by skilled birth attendant, which is actually a serious concern, especially in our 4 sub-counties of Baringo South, Tiaty East, Tiaty West, and Baringo North, part of Baringo North. That is the lower side of Baringo North.
By targeting the healthcare promoters, these are the people who are in touch with the family, the community, the mothers, the fathers, and the children in the community. They see the health problems firsthand, and they are actually being based in the community. They also are aware of the challenges, and they're actually part of the solution makers in reducing maternal and neonatal death. And Baringo County, based on the statistics, the current Kenya demographic health statistics, is actually on the red side in terms of the number of mothers and babies who die. And that is why we actually targeted this region. And therefore, this training is really targeting, and we know that this is going to have a lot of impact in terms of indicators, because now we are dealing with the primary level.
This is actually a start. This is the first cohort of 35 CHPs. Our appeal as a county is to request for more support. I'm double sure this training will bear fruits. Others, on behalf of the Department of Health of Baringo County, all the way from our CEC Health, from our chief officers, from the leadership, we really appreciate Moi University, School of Midwifery and Nursing, and by extension, NEPAD, for supporting this training.
Our main intention is to empower this cadre of healthcare providers who are in the community to refer after identifying pregnant women or any problem that is health related. They can be able to refer to the healthcare facilities.
Asante sana. Kwa majina naitwa Daniel Osute. Mimi ni CP kutoka Town Bay Unit, Yati East Sub County. Na nimefika hapa hivi na kufurahia sana mafunzo yenye tumepata hapa hivi kuhusu maneno ya maternal nutrition, yani lisho bora, hasa wa kina mama wajawazito na vilevile wenye wananyonyesha. Tena tumefunzwa kwamba kuna hii shida ya wamama kusaidia huko nje, huko nyumbani. Tumefunzwa, na hapo awali tulikuwa tumetuelezwa, lakini leo tumefunzwa kabisa kwamba ili to reduce hiyo kupoteza watoto ama kupoteza mama. So tunaenda huko kwetu kuhakikisha kwamba wamama wote wajawazito wanasalia hospitalini ama zahanati, na hiyo ni kazi yangu kama CP kuhakikisha na kumonitor amefika kule.
It is our hope that through this training they will be more empowered and encouraged to be actively involved in those identification and referral processes to be able to help our women and children and any other health challenge that they find in the community. This NEPAD supported us and we are very grateful, but we could not be able to train all of them because there are many. So these 35 community health promoters will serve as TOTs, since we have the community strategist focal person. This person will be able to engage the rest of the community health promoters together with those who have been trained, and we hope that women will be given better care and children will be given better care, and identification of those at risk will be referred. And so I take this time as the Dean of the School of Nursing to appreciate Dr. Rose and the CEO NEPAD, Moi University, for granting us the opportunity even to be able to leave the work or hand over the work to somebody else at the university to come down to train the community health promoters. Our role is to ensure that we have pregnancies that are normal and deliveries, and that mothers and their babies are healthy. Thank you very much.